Hello guys, and welcome to this video to review or even to learn what to do in the first appointment with your patients. Okay, because of course you guys graduate, we know already how to do history taking and how to collect data of the patient, but then of course when we graduate we don't know exactly what to do. Sometimes we forget about the order of procedures, so that's why we are reviewing this, especially for those who just graduated and are receiving the first patients. Okay. And of course, first you need to treat well your patient. Okay, so that's the first tip. You are going to receive this patient, and if you think about the patient as a number, then chances are that you are going to have some issues in the future. So we are here before being dentists. We are being healthcare providers, right? So we are providing healthcare to patients. That's what we are doing here. So you are receiving the patient comes with concerns, so you need to talk to the patients to receive this patient nicely. And of course, you're going to develop a strategy compatible with your the culture of your country or with your, the patients that you have. But everyone likes to be treated nicely, and that's actually what you need to do, especially in your first appointments, because you are going to meet the patient for the first time, usually. That's why we have the picture in the top left to remind you guys that you guys need to talk nicely to the patient and then talk to the patient, listen to the patient. So history taking, medical history of the patient, all right, family history, medical history, then dental history. Of course, the treatment should be driven by the chief complaint as well. So maybe this first appointment is an urgent appointment. Maybe it's just the first appointment of a series for an oral rehabilitation. So you need to act a little bit differently for those two situations. But regardless, you are going to proceed with a clinical examination. So that's the next picture on the top middle of this screen. And then you are going to do your very nice clinical examination. Even if you have 15 minutes for patient, you need to check soft tissues. What if there is a tumor in the soft tissues? Okay, so you need to check the soft tissues of the patient, all the teeth, all right? So first you are going to start with the physical extraoral examination, so palpation, lymph nodes, okay, so bilateral symmetry, you're going to assess, even looking to the patient. So that's why your examination starts when the patient is coming to your chair, okay? Then of course you are going to proceed with the intraoral clinical examination, and you need to collect more data. So you can start, for example, with a nice impression here, or intraoral scanning if you are already doing only digital workflow. So then you have the intraoral scans of both arches and the bite registration of the patient. If you guys don't remember how to do that, there are videos about digital workflow. And then if you don't remember how to do an impression with alginate, there is the video also. I will make the link available here. It will show up at the top left corner of this screen at some point. So you are going to take radiographs for the situations that you need. So of course this needs to be driven by the clinical examination. And then it's good to record the initial situation of the patient, because once you have the follow-up, and of course radiographs can be used to follow up treatments, just like those two dental implant placements with grafts, sinus grafts, and even the follow-up of these existing already root canal treatments here, right, of this premolar and the canine. So of course you guys will explain to the patient what the images mean and what is, what's your outcome from these investigations, okay? So you should, if the patient understands, the patient trusts you, and that's how you transmit knowledge to the patient. Just imagine when you go to the physician, to a doctor. If the doctor doesn't explain, just give you antibiotics, and if he or she doesn't explain you the reasons, then you can even take those antibiotics, but you might not trust this doctor so much. At least less than if the doctor explains to you the reasons, all the biological reasoning behind those decisions. Okay, so that's why we should know even the basic areas: physiology, radiology, anatomy, because we are going to use this knowledge to explain the treatment for our patients, and that's very important. All right. And then even clinical intraoral radiographs, photographs, you can also do that. So clinical intraoral photographs, because then when you have the final situation of the case, then you also can show to the patient the difference between the initial and final clinical situations. I'm just showing this case because this was the case of one of the last videos. If you guys want to just, do take a look at this entire case, because there are also the radiographic images, and it's a nice case to show all the steps of a rehabilitation with dental crowns. All right, but that's actually the secret: transmitting knowledge to the patient, and now taking decisions that, of course, collecting data in this first appointment for you to discuss even with other specialists from your clinic, if you have a clinic with different specialists, or even if you're going to take the decisions yourself, then give yourself time to take all the decisions, solve the urgent aspects, and then with the data that you collected, you can plan a very nice treatment for this patient. Okay? So if you guys like, please hit the like button, and see you guys in the next videos.